So we'll look at the hip hike gait, or they call it the hip hiking. So hip hike gait just simply means one part of your buttocks is higher than the other one when you are walking, and it's because there's injuries to a particular nerve, so one side is weak. So this is kind of like a way of compensation so that you can walk at least normal. So it's a compensatory walking pattern, just like I was saying. This one part of the pelvis is higher than the other, usually just to help the foot to clear the ground when there's limited hip, knee, or ankle movements. Okay, so it's an exaggerated upward tilt of one side of the pelvis during walking, so the pelvis stays relatively level. That's on the normal gait, right? Your pelvis should be normal, like this. Do you understand? With a slight drop on the swing side. But when we say there's a hip hike, it simply means the pelvis on one side is high and the other side is low. Okay, so causes is all those musculoskeletal limitations like reduced hip flexions, limited knee flexions, ankle dorsiflexion weakness. It could be neurological issues like all those stroke, cerebral palsy, multiple sclerosis, And sometimes you are trying to compensate for one leg being shorter than the other one. Then weak hip abductors. So pelvic fractures. Okay, clinical features rather. So the pelvis is elevated on the other side. There's reduced efficiency of the gait, often with circumduction. Then there's visible asymmetry. When the person walks, you can visibly see that one side of the buttocks is higher than the other one. Okay, maybe accompanied by trunk leaning or other compensatory methods, just to fill in for the gaps you have there.